Hi guys, welcome to the second part of this short video series on how to overcome sciatica at home without the need for injections, painkillers or surgery. My name is Will Harlow and I'm here to show you how to identify something called your movement preference today. We're going to talk about exactly what a movement preference is, how we find it, and then in the next part of the series we're going to talk about what we do with the movement preference. So today we're going to be talking more assessment methods, so it's a self-assessment that you do at home, and tomorrow we're going to use what we learned today to put it into action to give ourselves significant pain relief from sciatica. So let's talk about a movement preference. So a movement preference basically means the movement of your spine that doesn't cause you more pain and actually will encourage healing in your lower back. So this is especially useful if you're suffering from a disc problem or a joint problem in the lower back, including one that's caused by aging changes. So this has the potential to eradicate the symptoms that are felt with aging changes. So can truly be a miracle approach for some people, but first we need to establish the basics, which is choosing your movement preference. Okay, we're going to look at 6 movements today. All you need to do is try each one and pick the one that is the least painful. So I want you to score each of these movements in pain from a 1 to 10 scale. So if 1 is hardly any pain and 10 is worst pain imaginable, you're going to take the score that's the lowest. So you might even want to write this down. Okay, so we're going to do 6 movements. They are forward flexion, extension, side flexion right and left, and rotation left and right. Okay, so let's start off with flexion. So you're going to start off by finding a nice space in your house. You're going to stand up nice and straight. You're going to put your hands on your legs like this, and you're just going to use your hands to slow yourself down and just go as far as you feel able. Stop when you get to pain. Okay, so if you can go to here and then you start to feel pain, just stop, come back up and score that movement out of 10 for pain. Okay, simple as that. That's number 1. Number 2 is extension. So we're going to go the opposite way. So the opposite way is leaning back. So you'll start off just by putting your hands on your hips and just very slowly let yourself come back and then back. Okay, again, stop when you get to pain. So if you get to pain there, stop, come back. Okay, think about the whole movement, score the whole movement from 1 to 10. Okay, next movement is going to be side flexion to the left side. So again, standing up straight. This time we're going to use your left hand, keep your body upright and just slide your left hand down and come back up again. Okay, for some people with a disc bulge, this is going to be a very painful movement, and then for others this actually might feel quite nice, so it's really important to gauge how it feels. The 4th movement is you're going to go to the right, so side flexion down this way and back up, and again you're just going to score that, so see how it feels. And then the last 2 movements are rotation. So start with your hands across your chest. You're going to first start by going left and back, obviously stop when you get to pain, left and back, then you're going to go right and back, right and back. Take your 1 to 10 scores from all of those actions, see which one you think was the least painful, draw a big circle around it because that's the one we're going to use tomorrow. Okay, so that's it guys, find your movement preference, write it down, and we're going to use your findings in tomorrow's video, so make sure you remember it. Thanks for watching, and I look forward to speaking to you tomorrow about how to restore movement in your spine.